How does inflammation affect osteoarthritis? Imagine a small fire smoldering quietly inside your joint. That's what chronic low-grade inflammation does in osteoarthritis. It might not seem dramatic, but over time, it causes real damage. In osteoarthritis, inflammation involves the entire joint, including the cartilage, the bone beneath it, and the lining of the joint called the synovium. This inflammation is usually mild but persistent, slowly wearing down joint tissues. When inflammation occurs, cells in the joint releases special molecules called cytokines. These include tumor necrosis factor alpha and interleukin-1 beta. These molecules act like messengers that tell the cartilage to break down. Cartilage is the smooth tissue that cushions your bones. When cytokines signal the production of enzymes like matrix metalloproteinases and ADAMPs, they start to chew away at the cartilage. This enzymatic activity weakens the cartilage's structure, making it less able to protect the joint. As cartilage erodes, bones may rub against each other, causing pain and stiffness. Inflammation also triggers pathways inside joint cells, such as the NF-kappa B and MAP kinase pathways. These pathways boost the production of enzymes that break down cartilage even faster. It's like a cycle that keeps feeding itself, with damage leading to more inflammation and more damage. When cells in the joint get damaged or stressed, they release molecules called damage-associated molecular patterns. These molecules activate immune receptors like toll-like receptors, which further ramp up inflammation. This cycle of damage and inflammation keeps going, making the joint worse over time. Inflammation doesn't just affect cartilage. It also causes swelling and pain in the synovium, leading to synovitis. This inflammation of the joint lining makes the joint feel swollen and tender. It also releases more inflammatory molecules, which accelerate cartilage breakdown. The inflammation can also impact the bone underneath the cartilage. It causes abnormal bone remodeling and hardening called sclerosis, which makes the joint less flexible and more painful. Understanding how inflammation works in osteoarthritis helps in finding better treatments. Scientists are exploring ways to block the molecules and pathways involved in inflammation. This could slow down joint damage and reduce pain. For example, some medications target cytokines or enzymes to help protect the joint. In simple terms, inflammation in osteoarthritis acts like a slow but steady attack on your joint tissues. It promotes cartilage loss, causes swelling, and changes the bone structure. Recognizing this process opens the door to treatments that can help manage symptoms and slow disease progression.